Welcome to Shared Practices. I'm here with my co-host and good friend, Dr. George Hariri. George, how's it going?
Good. I'm excited for our topic today. I think that it's always a good day when you and I get to record on the Shared Practices podcast. So happy to be here and excited to talk about some good CEO leadership topics today.
Yeah, well, and this one instantly brings some man, I wish this episode had been out 3 years ago before I tried to be a dental CEO and kind of stumbled at it. So this is very relevant at a single practice level. This idea of being the chief executive officer and acting like a business owner of a single practice can make all the difference in the world. And there's no CEO training in dental school. There's just
No,
not. Not even practice. I mean, because practice management and executive thinking are two very separate things. Would you agree?
totally.
Talk to us about that. What makes that special of just like how to operate a dental practice and manage it versus how to be a CEO?
Yeah. So I think like we've talked about this on the podcast before, and I think that I want to approach the conversation from a slightly different perspective, where I think that this conversation can be very vague.
Mm.
And I honestly think that that's the best way to have this conversation, because I think once you go too specific into the conversation, you really stop being a CEO and you start really just being a management type. Like it's just
Glorified
management,
manager.
right? Yeah, it's just the manager. And so I think that, like, if you think of like the E Myth is like a very famous book that talks about the technician, the manager and the entrepreneur. And it's like, I think that if we were to kind of have the whole podcast be focused on a system or a process, that's really management. And really, to be a true like CEO of your business, it's really the leadership piece that is the piece that you are providing. And that's not necessarily something that we can just say, like, you can listen to this podcast and I can give you like 6 or 7 things that you're going to write down and do, and then like now you are doing that. Because I really don't think that that's a proper embodiment of what it really means to be a CEO of your organization. And so um
Can I add something since you brought up E Myth there?
yeah.
E Myth was one of like the books that there was a lot of like my thinking before shared practices even started that was like, okay, I want to E Myth practice ownership and like talk about this from these different perspectives. And the problem with being starting as the single doctor practice owner with no office manager is that you are all three. You're the technician, you're the manager, and you're the executive, you're the visionary. And your problems usually all come from not having management solution. So I think like dentists don't know how to manage their office. They don't know how to put the systems in place, manage the people, and like it can go on for years, 10, 15 years where a dentist really doesn't know how to manage their team or their office, and there's so much good to be done by solving that problem. But because this is a little bit more nebulous, this decision of how do we make decisions as a visionary, as an executive, is not like the pressing problem to solve. I think a lot of times for dentists, like they can't even separate them. It feels like it's all one. And so it does take sometimes a little bit more seasoned of a practiced owner to them for them to be able to kind of see the difference, even having experienced it all. And even recently, I've been listening to a lot of Alex Hermosi. He's like my new favorite business mentor. And he talks about, $3 million companies and $10 million companies and $50 million companies and like the differences in hiring and making decisions at these different levels. And I'm like, okay, now I've done a little bit of that. And so now like these things become very relevant and interesting to me. And when you're just at the very beginning part of your journey, you're like, I'm just trying to solve management problems. I don't even know how to think about these problems. So that's what we're hopefully going to be talking about today a little bit.
Yeah, so I think, like, to go, let's just keep staying on that analogy of the the three legs of that stool. So, like, the technician, right? So if you're the dentist providing clinical dentistry, like, you by definition are not in those moments where you're doing dentistry a CEO. You're really the technician on behalf of the practice. And the moments where you are doing, so I think management, I really want to spend a minute to define management.
Yeah.
So management is the ongoing, regular, and recurring activities that are responsible for managing the day to day operations of your business. So that is your management, right? Your team meetings, your like reviewing your financials monthly, whatever processes you have in place to check to make sure that the business is performing normally, that's your management. And ideally, you should have an like as you grow, right? A single practice, like a single doctor, small office, like you are probably doing that yourself, right? You are probably the technician, the manager, and the entrepreneur, right? But then as you grow to multiple doctors, you should have an office manager doing the management, right? So then you should be the technician and the entrepreneur, and you should have a manager. And I think that, that like really the CEO role in my mind, as I think about it, it it's the things not encompassed by the clinical dentistry or the regular activities at the practice. Like that is the scope of the position. It's the things that are not defined and not, the delivery of care. So I think that, Richard, like maybe can we get more clear so our audience can like understand?
Well, I think this is and this is once again, it's another Hermosi thing because that's the world I've been in. So sorry, y'all, you're going to get some secondhand Hermosi here. Um, One of the first decisions that you run into as an entrepreneur, as a dentist scaling a practice, is the allocation of resources.
Yes.
So I've got time and I've got money. There's a certain amount of profit coming in the
Yes.
door, and I have a certain amount of time in the day. And right now, I'm wearing all the hats and doing all the things, and I'm choosing to pull from that pool. And it's like the dentist doing social media influencer type marketing as a startup. Like they have more time, they don't have a lot of money, and so they're like spending their time over here. There might become a day when they're at multiple doctors and they're like, I don't want to like be creating videos. I want to have a marketing system that doesn't depend on me and I can trade dollars for new patients. But I think more fundamentally is, do I want to do this job myself or do I want to hire someone to do this job? And that's a CEO decision of how to allocate resources. Is that
I think that that's a
good starting place?
spectacular framework. So, allocation of time and resources. And I think another resource is focus, right?
Mm-hmm.
So, for example, let's just say you're operating a practice and you have an office manager, right? In this situation, you should have an office manager. Like to be a CEO, I think we're talking about 2 doctor practices. You're like starting to be the CEO. Then once you go to like 3 doctors, you're really needing to be a CEO. And then once you go beyond that, multiple locations, like you really need to do that. And so imagine you have like a 2 doctor practice and you have an office manager and everything's going, humming along, you're operating. And you are trying to decide where should we be focused on next? What's our growing edge next? Do we take the team to a course and do we add implants? Do we add Invisalign? Do we work on our case acceptance? Maybe we need to roll out a standard procedure or process for how we verify insurance, right? Like all of these different things are on the menu that you can focus on, your office manager can focus on, you can spend money training your team on, and you are trying to decide where is the best place for me to spend that limited time, energy, and focus. And so like that's one of the most important decisions you make as a CEO is where are we focused on improving? Where are we focused on growing? And like that in and of itself right there, like that's not a regular operating activity. It's going to keep evolving and changing month over month. But like that's an area where you are driving the business forward and, really need to have that strong leadership. So I think, Richard, that's great. And I think maybe if we had like 1 or 2 other ones, just so that the audience can get very clear on the fact of like, what is CEO function? So CEO function we've established is allocating how we spend our time, focus, and money. Now, what else can we put in that same bucket?
Well, and I just loved the focus example because you think of like the first year owner who's just bought a practice. It's just as important. What are we going to say no to
Oh my
as
gosh,
what are
yeah.
the few things that we say yes to, and how long are we going to train, retrain, audit, reinforce that thing? That's a decision that early CEOs in a dental practice situation often get wrong. They do too many things at once. They don't train it enough, they don't audit long enough, and that change actually doesn't get fully implemented. Um, so that would, I love the framework of focus, and part of that inherently includes what are we saying no to.
Okay, well then maybe let's just talk about this, right? Instead of like, maybe having 5 different examples of what a dental CEO does, let's just talk about what a CEO would do on this one thing. So, okay, do you have another?
I have another,
Good.
which
Yeah, let's
like
do another.
this is just like our last episode. Like, oh, how do we not talk about this? Looking at metrics, collecting and analyzing data about the operations of your practice in order to assess, is this some worth putting? This ties it all in. Is this worth putting time, money, or focus on? Because this is the problem that the numbers have told us is most broken or has the most opportunity for gain.
Yeah. And I think, the way that I would think about that is, you're really wanting to have a deep understanding of your business. Like you want to, and I think that that's an ongoing function of a CEO, is to be looking at, like, off the top of your head, if I were to ask you, what does your practice do well? We said, well, compared to other practices, we do this particularly well. What is your practice weak at? Well, we're still struggling with this. What is your practice's bottleneck? What's preventing you from growing? Oh, well, we just don't have enough patients or whatever, right? So like to be able to like quickly rattle off those answers requires that like poring over the numbers on a regular basis. That's part of leadership as well, right? That deep understanding, having a very deep and thorough understanding of your business. But now I want to kind of go back to what we're talking about, right? Like, so what does a CEO do with this information? And I think the biggest thing that I would, I really like the oars on a boat analogy for this. So it's like, ultimately your team, right? You are not practicing. I would imagine every single person here who is a practice owner is not alone in their team, right? They have dental assistants, hygienists, team members, right? So everybody has a team. And, the CEO is ultimately the person who is like guiding that whole team to make sure we are all collectively moving in the right direction. And so, the boat analogy I really like, right? The oars on a rowboat, is everyone rowing in the same direction? So are we all aligned in our movement? Is one thing that a dental CEO needs to look at. And then the other thing that they need to look at is, are we moving in the right direction? And so I want to provide 2 tangible examples. So the CEO of the business, they always say vision, right? CEO vision, like those 2 things very closely connected. And so let's just say this is an owner of a 2-doctor practice. And this 2-doctor practice, the owner wants to have a 4-doctor practice one day. So then in the back of their mind, they're thinking, okay, we need 4 doctors in the future. We also may need to move facilities. We also, may need to have higher new patient flow in the future, right? So they have a good idea of what the future that they want for the office to look like. That's their vision. Then we're going to look at our team members and we're going to say, are the actions that they're doing moving us towards those outcomes? So we say, are the hygienists, are they retaining patients to the degree that we need to get to that outcome? That would be the hygienist rowing in the right direction. Is the office manager developing the structure internally that we're going to need to manage that type of operation? That would be the office manager and the hygienist going in the same direction, right? So it really is, it's like the orchestra leader is making sure that, everyone is on tune doing what they're supposed to be doing towards the future direction of the business that we're trying to guide it towards. And I think, like, in a nutshell, that is the job. The job of the CEO is to understand, where is this thing going? What is everybody on the team doing? And how does that relate to where we're trying to go? And is our time, energy, and focus all being put in the right places cohesively to kind of accelerate our journey to our desired destination? So is that like, I'm usually when I speak, people give me the feedback of it's kind of not tangible or clear. It's hard to understand what I'm saying. So like, that's why I'm asking for feedback. Like for me, this is clear, but for you, Richard, is that clear on the receiving end?
Yeah, well, and I think absolutely. I think the hard part for dentists who this is their first time in ownership, which usually it is, like not many dentists are serial practice openers, even if it's a single practice. Like on average, people tend to own 1, maybe 2. Very few people own 1, build it up, sell it, and then do it again. Maybe you move, maybe life circumstances. But the problem with that first time owner, no matter, even if you're two doctors in, is like you don't quite know where this can go. And that's one of the biggest, like, this is a limiting belief, a limiting piece of your vision. Like, you're absolutely right. This is, we're trying to get there as a team with our time, effort, resources, focus to the eventual place that we can go. But like, what if we don't even know what's possible? And what if we don't know the problems, the costs, the risks, then the options of that next stage? And so, I think one of the challenges of a dental CEO is figuring out what is possible and what do I want? Like, those two questions are harder to answer than they should be.
Well, and that's why we have, our unique mechanism at shared practices is our precision growth pathways, right? And that's where we essentially have avatars for every different type of practice, and we show them to a dentist on a map, and we kind of have different income levels too, where we just say, like, you can take your practice here and make this much money and have this lifestyle. You can take your practice there and have this practice value and this, but I think, I think that if you're listening to this episode and, you're drawn to the idea of being a dental CEO, the first step of that journey is to really understand, like, don't start with your practice, start with your life. I find that that's much easier. So you start with your life, you say, what do I want in life? And I think the questions are, how much do I make? How much do I work? And what am I doing for work? Right? And just, I kind of ask those basic questions. Be like, okay, well, how much do I want to make? And really look for, one thing that I look for a lot, and I ask people this, is look for your best days for clues. Look at your worst days for clues, and make it so that the future is more of your best days and less of your worst days. Right. So it's like, just at a very simple level, like for me, when my worst days were when I had to send a patient out in the middle of an extraction, or when I had a treatment outcome that didn't go the way that I was wanting it to go. I just, like, the clinical stress was for me like the hardest part. And the things I loved were like tinkering with the insurance verification system, or, these types of things, very, very unrelatable for people. But like, I think that for the dentist listening, right, just ask yourself, like, oh man, like when I did that, anterior case, and like, it just, the patient cried when they saw the result, like, that was just the best day. And then you're thinking, man, when that team member came in late and I talked to them and then it was awkward and they got defensive, and like, that just made me uncomfortable all day. Right. And so it's like, whatever your
ruminated
best,
about it for a week.
you're just sitting there stirring, and you're like, well, when would you have to fire the person? Are they ever going to come on time? Like, it's like, so you kind of put yourself in buckets and you say, okay, well, what do I love? Put those in buckets. What do I dislike? What drains my energy and makes things feel a little soul sucking? Like, put those in buckets, and then look at them and be like, okay, well, like, learn about yourself through that exercise, and then guide your practice in the direction towards the things that you like, and try to put people or processes in place to essentially like shield you from the stuff you don't, right? And I think that that's not necessarily a bad thing, so long as, like, the business needs somebody to, like, let's just say that we're talking about this dentist who doesn't like talking to team members about uncomfortable things, right? Well, the business needs that. People aren't always going to do exactly what you ask them to do all the time. So you need an enforcer, right? But maybe you don't need to be the enforcer. Maybe you need to bring on an office manager to be that enforcer on your behalf. And then now you, the CEO of the business, are guiding the business towards what you want for it and what it needs, which is a manager to hold people accountable. And so it's like, I think that you gotta use, like, I think at the end of the day, one of the most beautiful things about private practice is the fact that you get the opportunity to set the terms of engagement between how the business runs entirely. And I think that when you say, okay, this is what I'm like, this is what I like, this is what I don't like, this is what I want, this is my plan in life. Like, all of those things should be how you decide where's the business going. The business should be going towards what you want. And like, I think that ultimately, like, the vision should come from you and what you want. the business should then follow that direction, not the other. Like, oh, it's best for the business if I do all these things I hate. It's like that doesn't work. So, Richard, maybe you could help the audience, kind of like maybe the person who's stuck, who's like, I don't know what I want, like
Right.
help them break through that if that's where they're at.
Well, well, first off, I think you did a really good job of helping people decide, do I want clinical problems, non-clinical problems? Do I want entrepreneurial problems or clinical problems? I think a harder problem is for the entrepreneurial dentist who would really want to be listening to this episode to decide, I like building things. Where do I go? Where do I stop? And here's what I think we end up doing very often is saying, okay, I've scaled dentistry to a certain point. Now I either need to like go bigger and buy like another, I'm at a 3 doctor practice. It's amazing. I would need to double down and go to like a 5 doctor practice or 6 doctor, expand even further. Or I'm going to buy another practice after this. I think one of the coolest things you can do is, and this is prescriptive, this is like, I told George, don't prescribe people of where they should go with their dental practice, that we have all the avatars and we know that. And we used to have that debate long time ago, but it's really cool if you can set up an asset that has, namely one healthy dental practice that's not dependent on you clinically, that has a lot of value in it, has a lot of cash flow, has a lot of stability. And then you have the freedom to diversify your CEO focus into all sorts of other things. It could be other businesses. It could be the rest of your life. It could be into charitable causes. It could be scaling, but you're like, I'm going to use this as my nest egg that allows me to go build new things and do other fun things. I just think that's a really good stopping point for anyone who's like in this mode of like dental CEO. Get there, remove everything that you hate doing. Like George said, 95% of the things that you can delegate or get rid of that you don't want to do. And then play with that for a few years and decide, is there other stuff I enjoy doing outside of dentistry that doesn't put at risk this core cash flowing golden egg asset that I have? I think that's a really cool destination to shoot for because you have so many options. You can sell it, you can scale back, you can add another office if you really want to. So I do think there's a point in dentistry where the cost to scale and the difficulty to keep scaling gets really kind of weird for a while. And so staying at this like happy, well-run practice without a lot of risk, with a lot of cash flow, a valuable asset, opens up all sorts of doors. Just don't put that at risk and you can do whatever the heck you want. So I don't know. That's just what came to mind as we were talking about this.
Yeah, it's really interesting that you say that. So recently, I've kind of just been chatting with a few mega group owners. And, I think mega group is kind of that spot in our avatar language where it's like you have a $3 million practice. You work usually 2, maybe 3 days a week clinically, and, usually are making a strong income at that level. Like that's usually the place where people don't really know what's next for them.
Yeah.
And so I spoke with 3 people, and I was essentially just trying to ask them that question, like, what's next? What's on your mind? What are you looking at doing? And I got 3 very different answers. I had one saying, I want to acquire another practice. I had one saying, I really want to do a startup. And then I had one saying, I have no idea what I want. And I think the one I really want to address is the one who said I had no idea. And what I told him is I said, then like start to turn your mega group into a more set it and forget it mode, which is essentially like, operating it in such a way that's very sustainable long term, and give yourself the space. Because oftentimes what happens is when you give yourself that space, then like you just find the next kind of growing edge. Because I think we attract a very growth minded person. Yeah. And, so like somebody who's acquired a practice, grown into a mega group, like they like growth, right? So the idea of like, okay, you're never going to grow again. You're never going to have pursuits. Like you're just done. And it's like in their mid 30s or whatever. It's like, that doesn't really work for people. And so, but at the same time, you don't necessarily want to go from one thing to the next so quickly. And so taking a temporary space in your life and just saying like, I know I'm going to do something next. I don't know what. So let me work on making this practice like less and less of my effort and more team led. And then like I'm just going to wait for it to hit me. And it's kind of weird, but it always does.
Yeah.
And I think that like, that's just kind of like for the person that doesn't know and they're in a really good situation and they don't know what's coming or what's next for them, essentially just making that situation more sustainable and starting to pull back will allow the space for that next wave of energy to kind of come to you. So
I
I
love
think that's just my advice for anyone who's in a good spot and doesn't necessarily know where to go from there.
Well, and it's like the weird little men's group I've got over here on the side that's focused on fitness is called Next Level Fathers. My hypothesis is the next level is not always another clinical course or
Yeah.
another office, another thing within dentistry. And going back to this, I actually think if someone is truly deeply entrepreneurial, like, and I think you and I have flipped on this. This is hilarious to me. I now think like there's a lot better verticals that aren't dentistry that you can scale a business inside of. Like if you can be patient and intelligent, just like we talk about with acquisition of a GP office, if you can put yourself in the right circles, look at acquisitions of other businesses, or start other businesses that have not the same risk profile that like a dental office does. Like it's low risk, but it's high people intensive and it doesn't have any inherent scale. You think about like digital products or offerings or software, there's all these different ways to do business. Go play in something else without putting your dental asset at risk. And sure, you might not make life-changing money, but guess what? You already did that in your dental office. And now you get to like learn a whole new thing. And maybe the first thing you do won't work out, and then you'll go do another thing and it will work out. But I think my push to the true entrepreneur who is a dentist, who's built some degree of success, is try some other things before you keep pushing in dentistry. And that could be other businesses, that could be charity, that could be purpose, that could be fitness, that could be family. Go weird somewhere else before you come back to dentistry and just keep going blindly. And what you said, George, is exactly right. Just take a breather. And it might be another practice. It might be go bigger. But it's kind of funny that we're talking about the same thing from two different angles.
Yeah, and I don't know how we got on this conversation because I feel like we're talking about the dental CEO. So maybe we go back
Vision.
to that. Yeah.
Vision. We got to where am I going? And I
Oh,
think
that's right. Yeah, sorry.
no, well, it's this issue of the truly entrepreneurial dental CEO. One of the challenges, they end up scooping up a second, third, fourth practice
Yeah.
because they just couldn't help themselves. And I've
Hmm.
had conversations with dentists like that in the last 3 months where I'm like, well, what's your vision with this? Like, what's your exit strategy? Are you trying to build this up? Is this long-term buy and hold? And they're like, I don't know. I just couldn't, these were good deals. I couldn't pass on them. And that is the opposite of having the vision of a dental CEO. And this is where, as a dental CEO, it's uncharted territory because that final destination often changes.
Yeah,
Like
yeah.
where you think your vision of your practice and your life is going to be inherently is wrong, because by the time you get there, you'll realize you'll know new things that better inform where you actually want to go. I think that's one of the biggest challenges is you're chasing a moving target, but you want to have as informed of a next destination as you can. And that's what our practice avatars do is we say, here's this pathway that you can take to get to this size of practice. And that unlocks these problems, these opportunities, and you can maximize that for your life and for your long-term vision. And then it comes back to okay, now can I make decisions with time, talent, focus, resources on how to maximize what we're doing well, eliminate what we're doing poorly, eliminate bottlenecks, and think as a dental CEO. So we put two visionaries in a room and we got like our visionary hats on and we went off in the distance. But this is like the extreme of what it means to be a CEO.
Yeah, and I think, coming back to our conversation, right? To truly embody a dental CEO, you need to be very grounded in that vision, right? So, we've just talked about like how do I find that vision, right? So we've had that conversation. So like coming back to like embodying the position of the dental CEO, it's being aware of that vision and then guiding your team towards it, right? So I think that like the CEO is the eternal optimist, right? And so it's like no matter the day, you are very grounded in that vision, right? And the vision needs to be very compelling to you. So like it's like when you go into the office, you need to be going into the office with intent every day, and you need to be going into the office with intent on where you are trying to go. And then when, the random things continue to occur throughout the day that always occur, well, you now have the ability to micro modify all of these things that are coming your way towards where you're trying to go. So let's use this example, right? I'm going to bring the example back to what we're talking about. So
Yeah.
we are talking about a dentist who is very driven, a dentist who has reached a mega group or some type of very sustainable spot long term. And they're not sure with their vision, right? And so we've said in this episode, like, okay, like understand that you might not be so sure right now, but then my argument to them is then make your current practice as team led as possible to continue to provide space for you to find that. So then you go into the practice, and every day you're going into the practice and you're grounded in that vision. And that vision is this practice is going to be team led so that I can find what's next for me, or I can take some space and focus on fitness and family, or I can do whatever's best for me. So you go into the office every day grounded with that purpose. And then when a team member comes up to you and they say like, "Hey, doc, we have this particular situation, and I need your assistance or guidance," then you would say, "Well, I could guide the situation, but is that making it more independent? Not really." So then you're going to look at all of these situations from the perspective of your vision, which is pulling back and taking space. And you're going to say, okay, well, how can I teach my team how to solve this problem without me? And then you then micro modify. Every week they come with a question, you're going to like just kind of moderately change how they're doing it. And what you're really doing is you're guiding your whole team towards where you're trying to go, which is space and separation from the practice so that you can focus on what's next, right? So even in the situation where we don't have a vision, we can still provide an example where a CEO is guiding their practice towards a more team-led environment so that they have space to pursue their vision. And even if it's not in the practice or whatever, right? So it's that intentionality behind what you do so that I'm not just like reactively answering all of these questions that team members are coming my way. I'm being asked a question and I'm guiding the team based on my direction. And in this situation, we're using the example as your direction is less involvement in the business and it being more sustainable for you long term to hold the asset, then that's the vision that you're operating on. And you're going to keep micro modifying your team to be more and more team led and have more processes documented so that you can then have that space. Right. So I think for me, like when I really think of the dental CEO, I think of that person who is grounded in the purpose behind what they're doing. They know the direction and they're guiding the whole team to that direction in all of the minor decisions that are being made. And I gave the dental CEO lecture in January. And I think I lost the room a little bit on this because people don't really understand how important the micro decisions that you make every day are. Like how you answer this question, how we like they just come to you with stuff all the time, team members. And like the way that you guide those small interactions has very compounding effects. And like I think a really strong dental CEO is somebody who is guiding all of those micro interactions towards their desired outcome every time or all the time or very consistently. And so, Richard, just curious what the kind of maybe brought up.
Well, I think an example of that is, and that you've embodied this really well, and a lot of dentists struggle to do this, is if I eventually don't want to be the one answering these questions, then you don't answer these questions right now.
Yeah.
You force people to go to the office manager. They're asking you an office manager question, and they're like playing mom and dad against each other. They didn't like what the office manager had to say, or they know that if they go there, it's going to be, but they're friends with you. They're buddy with the dentist, and I'm going to be able to like work my magic and get what I want. And so not letting team members pull you into a role that you as a CEO are exiting because it's not a good use of your time and focus. And so I don't know. That's what I think of when you say that is a micro interaction of someone coming to you with a question that they should have gone to an office manager. And instead of doing the nice thing and playing buddy buddy and just be like, oh, okay, well, and you kind of like meddle, you like insert yourself into this system that you've built in order to pull yourself out of, be strict and say, awesome. You know what? I don't know. You should go ask the office manager. Is that what you're getting at?
Yeah, and it's essentially like, but I think it's really about, right? So we talked about, let's go back to the beginning and let's talk through kind of the things we've talked about, how they relate to each other and how they relate to being a dental CEO. Because I'm very conscious of the fact that this is vague. And so, like you are a dental operator owning a business. So there's really three roles. There's the dentist doing the dentistry. There's the manager ensuring all of the regular activities are occurring that are required to operate your practice every day. Then there is you, the dental CEO, the entrepreneur, who is guiding the business, pushing it long-term through your vision, right? So the correct sort of, or the best embodiment of being the dental CEO is really just through all of your influence on the business, whether that's how do we allocate time, energy, and focus, or how am I answering these small questions? Like whatever you are doing that impacts how the business is performing, you do that with intention, right? So that's where you get I think a bad example of this is somebody who just kind of like plays the game of whack-a-mole and they're just like doing things to improve their practice, or they're just like they're just operating without really a sense of direction to it, where it's like, I'm doing these things, but why are you doing what you're doing? So maybe you could look back and self-reflect, and you can say like, what are the last three things that I did to improve the practice? Or what are the last three things that I spent time, energy, and focus on? And then you look at those three things and you say like, what was the intention and direction behind those three things? And did they align with each other, right? Because when done well, you should be able to say, my vision is to grow the practice from a 2-doctor practice to a 4-doctor practice. The things in our way to do that are our new patient flow is not high enough. We don't have our systems down enough, and we need a bigger facility, right? So then it's like, okay, well, is my last 3 improvements addressing my new patient flow, our SOPs, and like getting us ready or thinking about the facility? Then if so, then you're embodying the dental CEO appropriately. But if you look at your last 3 things and you were like, well, I did this to improve our case acceptance, I did this to, I changed our vendor for something, and then I did something else, you're like, well, none of those 3 things I did addressed my core problems, moved us in the right direction, and potentially some things I did may have counteracted. So like that's, I think, like where I'm trying to get people to really understand, like the dental CEO is not a checklist or a process, or it's really just the proper leadership of the business with direction, alignment, and just like purpose. I think that those are like kind of the pillars that I would really kind of prescribe.
So I think I finally have like, okay, I can bring, and this brings it all back together. When we talked about metrics briefly, which, that's a whole nother episode, and we could do an episode on metrics as a dental CEO. There's 3 ways you can think of metrics, which is, are we doing this well? Are we doing this poorly? Which is the 2 we talked about. But the dental CEO, actually, those are not the 2 most important questions. Is what are our bottlenecks of where we want to go?
Yeah.
And is this the metric to solve that then allows us to move in that direction, which then allows you sometimes to ignore things that you're not doing well, that aren't the problem you need to fix right now. That is the proper allocate. You're saying no to, yes, we could fix this problem. Yes, I know my team members are annoyed by this thing that needs to happen in our office, or this system we need to fix, but that's not actually our bottleneck. Our bottleneck that stops us from going the direction we want to go, growing and getting to 3 hygienists and then 4 and then a second doctor, or, reverse the order there, is this problem. And this is what we need to have maniacal focus on and say no to everything else. Is that
yes.
Are we on the same page?
Great way of saying it. I think like that's, I think the barometer is if you know what to say no to, then like that's a really good sign. So I think, let me use a very tangible example. So I was in between dentists. So I was a solo practitioner at this time. I was checking for like 3 or 4 hygienists worth of patients, and I was waiting for an associate to come on board. And so it's like, let's just say I encountered a consultant or something, and they told me like, you could do these 3 things to improve your case acceptance. Well, it's like, maybe my case acceptance can have improvement, but like, I'm checking for 3 or 4 dentists. I'm waiting for another dentist. So like a CEO would look at that and say like, I need to focus on my patient flow and getting my schedule busy so that when I bring on another dentist, we're both busy. And then a CEO should also know when is the appropriate time to address that problem, right? So if not now, then when? And so it'd be like, well, when we bring on the next dentist, then that would be the right time, because then we're essentially going to have like that calibration period with the hygienist that's necessary. So we're going to just work on our case acceptance and focus on it all at once then, right? So then you're guiding your ship by you're saying, okay, right now I'm trying to get on that second dentist. I'm checking for multiple hygienists. So like my bottleneck is patient flow. So like that's where my energy is going to be. But I also have this nagging problem where my case acceptance isn't that great, but not now, but here. It makes sense, right? So then you're now guiding your whole team. Everyone's focused on patient flow right now. You bring that dentist on because you were focused on patient flow. The dentist onboarding is smoother because there's enough patients. They're seeing multiple hygienists worth of checks. And then you now have had the foresight to introduce case acceptance at the right time, right? So like that's an embodiment in a micro situation of a dental CEO. It's having the foresight to know what's coming, and also the discipline to know what's not right now, and what should be right now is usually your bottleneck or whatever is preventing you from getting to your vision. And so, like, I think that they kind of hopefully put it together for everybody, because like that's really what you're going for with a good embodiment of a dental CEO.
And I just had another epiphany, which is I think most dentists don't get there on their own. Definitely not. And that's actually why our coaches do so well,
Yeah.
is because we've trained them on here's the places you can go. Here's how to work with the dentist to help them figure out where they want to go. Here's how to use the metrics to identify the bottlenecks and figure out the things to focus on. So we've essentially figured out how to outsource the dental CEO to a coach who can train you up as a dental CEO. In the meantime, they're helping you guide the ship. And eventually, if you want to, you can learn from them how they're seeing, and it's inevitable over the course of 2 years, 3 years working with a coach, identifying bottlenecks with metrics, focusing on those with your team, growing. You learn just by doing it side by side with someone. But otherwise, even if you just turn metrics on, you know you're supposed to be focusing on things, you hire a random coach who helps improve a bunch of systems, you're not building that CEO muscle. And I realized we've allowed people to outsource that CEO muscle until they've built it enough to do it on their own.
Totally. Yeah, I think that's very well said. And I do very much agree that I think our coaches really help with that deep understanding as well. Pouring through the metrics, really understanding your business, understanding your vision, and trying to like marry the two pieces of information. Like, how does the deep understanding of your business and where you want to go guide what to focus on now versus later, and really then even a step further, we'll meet with your team and train them, right? So it's like, I think that coach can, they're just a massive, we really believe in what we do on the coaching side. So I won't say any more about it, but they're really, really great at what they do, and the results that we have speak for themselves.
Yeah. Oh, well, I mean, for me, I had to say it because I was like, okay, I know they help on the management side, but I'm like, oh yeah, that's why our coaches are really good. They're actually helping on both those fronts just as much. So, George, this has been fun. This is like, we're continuing just like last episode recorded. Like, we figure out new ways to communicate these things, and it's powerful. So I appreciate us having these conversations. It's incredible. Thanks, man.
Yeah. And I think I'm always mindful of the fact that, maybe while I think something is clear, it may not be clear to everyone listening. So I just appreciate the opportunity to kind of like bounce back and forth with you, and we may say things in a different way, and hopefully somebody had a couple of light bulb moments throughout this episode to kind of, help them along where they're at in their journey.
I love it. Well, we'll talk to you next time. Thank you, George, on the Shared Practices podcast.